More than half of schools in Scotland have reported at least one positive case of COVID-19 among pupils in the first 2 weeks of term. Figures from Public Health Scotland also suggest nearly 15% of all cases in the same period could be linked to educational settings. It comes ahead of the vaccine being offered to all 12 to 15-year-olds from next week. Here's Louise Hosey.
Coronavirus cases have risen sharply and there's been a surge in COVID rates since school pupils went back after the summer holidays. Now, new figures have revealed that more than half of all schools in the country reported a positive case in the first 2 weeks of term.
Since the first couple of weeks, the number of schools reporting cases has almost doubled. In most instances, it's between 5 and 10 pupils, and we have some more serious outbreaks. But certainly we are very well aware of the fact that infection levels amongst pupils and indeed amongst staff are at their highest ever levels.
The data also showed nearly 15% of cases during the same 2-week period could be linked to educational settings. From next week, all 12 to 15-year-olds will be offered one dose of the COVID vaccine after it was recommended by the UK's chief medical officers. The JCVI, which advises the government on vaccines, had earlier said it did not recommend vaccinating healthy children on health grounds alone.
One of them had a sore arm.
Arlene's boys aged 12 and 15 have already had the vaccine as their dad has an autoimmune disease.
Yes, there are risks, but I think the benefits outweigh them. The person getting the vaccine, it protects them from getting seriously ill. And unfortunately, there has been cases of 12 to 15-year-olds who have unfortunately died and become seriously ill from getting COVID.
Joanne's 2 children, aged 12 and 9, are currently at home after testing positive for coronavirus. She says they won't be getting the jab.
COVID is rife in schools just now, so ultimately a great majority of the kids are catching it. So they're going to get their immunity from that. I just don't see the need to force this vaccination. There's no evidence to say children get, extremely ill or unwell or get hospitalised. So for me, it's just the risk of the vaccine is not worth taking.
One expert says offering the vaccine to youngsters is needed in order to protect themselves and the most vulnerable.
Children may not be getting as sick with COVID, but they're nevertheless suffering the impacts of the pandemic. And so the more we can do to slow and to stop that, I think the better.
The Scottish Government says it's continuing to closely monitor the impact of COVID cases in schools. It says in light of the latest data and evidence, it's extending current safety measures, including face masks for secondary pupils, until at least the October holidays. Louise Hosey, STV News.